In my work as an internist and cardiologist, I have seen many patients die. If you have cared for a loved one who passed away, you can relate to this. While this topic may sound scary, there are advantages of being aware about it. When you see these warning signs in a loved one, you should consult a doctor and maybe save the person's life. Early signs of approaching death. This can occur a few months before passing on. Number 1, sleeping more and lack of energy. When you care for a terminally ill patient, you may notice the person to be sleeping more in the last 2 to 3 months of life. This means the body is becoming weaker. The person is also less talkative and more forgetful. They have less strength to move about. Number 2, increasing pain. Depending on the underlying illness such as cancer, the person may complain of severe pain. Consult your doctor on what pain medications can be given. Make the person as comfortable as possible to ease the pain. Number 3, lack of appetite. As a person approaches the end, they have less energy to eat and drink. This becomes a vicious cycle that will further weaken the body. That is why we should encourage patients and the elderly to eat more, entice them with easy to digest and flavorful foods. Keep their spirits up so they will have the willpower to eat and live longer. If they still refuse to eat, consult your doctor whether intravenous fluids or placing a feeding tube is necessary. Number 4, reduction in bowel movement and urination. Because the person is eating and drinking less, they have fewer bowel movements and low urine output. The urine may be dark yellow or brownish in color. The kidneys and body processes are shutting down. Number 5, they experience confusion and hallucination. Eventually, patients lose their orientation of time and location. They forget the names of relatives or things they've just said. They are confused and may say unusual things. Sometimes they talk about seeing people who have passed away. Be understanding and avoid confronting them. Next, we go to the late signs of approaching death. In the hours before a person dies, their organs shut down and their body stops working. As a doctor, we check for the vital sign. Number 1, breathing becomes labored or shallow. They have difficulty taking in enough air. There may be gasping or long pauses between breaths. In the end, there is a death rattle, a sound caused by saliva and phlegm being stuck in the patient's throat. Number 2, lower body temperature. Because of poor circulation of blood, the skin becomes pale and cold. There is mottling of the skin with bluish patches. Number 3, the blood pressure drops. Number 4, the heartbeat becomes irregular. Then the heartbeat may be hard to detect and eventually stops. A person caring for a dying loved one should make them feel as comfortable as they can. Talk to them and assure them of your love. By being aware of these end-of-life signs, we may be able to care for our loved ones better. This will reduce feelings of guilt and anger afterwards. Take care.